my limitless ladies. Welcome to Menopause University. I'm Menopause Taylor, your limitless teacher. And I'll go to the limits of the earth to ensure you get the education you deserve on menopause. Here we are at video number 293. And if you haven't already guessed, it's on limitations. We've been addressing the use of estrogen replacement for purposes of preventing the three big diseases due to estrogen deficiency: heart attack, osteoporosis, and Alzheimer's. And I've explained all the capabilities of estrogen along with the reasons it can prevent these diseases. But as I have said so many times in the past, everything, absolutely everything, has both capabilities and limitations. And estrogen replacement is no different. You have come to regard me as the educator who always tells you the whole story and the whole truth. And it would not be appropriate to leave you with the impression that estrogen replacement is omnipotent. Like everything else in life and everything else in the world of menopause, it has limitations too. So today I'll be pointing out the limitations of estrogen replacement with regard to the three big diseases. Now, why do you need to bother watching this video? Well, it's because you have to frame your expectations realistically for your menopause management. And if you only know the capabilities of an option and you ignore its limitations, you will fall short of your goals. In my book, regardless of whether you have the first edition or the second edition, this particular presentation is not a standalone topic. It's included in the various chapters on each individual disease. So let's start by defining what we mean by the word limitation. A limitation is a lack of capacity. It refers to something that is not possible. When it comes to estrogen, it pertains to the things estrogen replacement cannot accomplish. Nowadays, it is so common for people to hear that some product is capable of performing some task, and they clamor to buy the product, never stopping to ask about its limitations. This is very common with beauty products and anti-aging products. Here's an example. Have you ever noticed that commercials about anti-wrinkle creams feature very young models? They have nary a wrinkle or even a fine line anywhere on their bodies. And why would they? They're only about 16. Of course, they don't need the anti-wrinkle cream. It's not something they'll need to give even a thought to for about 30 more years. Nevertheless, when you see them in the commercial with their beautiful skin, dewy, perfect, smooth skin, you interpret it to mean that the cream will make you look as flawless as they do. You focus on what the cream can do, not on what it cannot do. And you probably don't say, hey, wait a minute, the model has no fine lines or wrinkles. So is this cream just capable of preventing them if you don't have them already? Or is it capable of erasing the ones I already have? You see, there's a huge difference between preventing wrinkles versus erasing wrinkles. Such commercials are misleading because they target older women for products only older women need, but they use younger models to promise more than the product can deliver. If the commercial were to give you the whole truth and the whole story, they would be sure to say, don't expect this product to erase wrinkles or lines that are already there. It can only prevent them, it cannot get rid of them. I've yet to see any commercial that honestly and completely divulges the limitation of its beauty product. So, although I've taught you how significant estrogen is in preventing the aging process, I want to also teach you its limitations. There's a quote that says, "The only limitations are the ones in your own mind." And when it comes to motivation and such, that may be true, but when it comes to estrogen replacement, it isn't. Now, there are two broad categories of limitations. One is self-limitations. Self-limitations are limitations that are specific to the product itself in isolation. These limitations have nothing to do with any other product. So in the case of estrogen replacement, self-limitations would be the things that estrogen cannot do, period. In contrast, the other type of limitations are comparative limitations. Comparative limitations are limitations of one product compared to another product. In the case of estrogen, comparative limitations would be the things that estrogen can do, but not as well as some other option, or the things that other options can do, but that estrogen cannot do. If we use the analogy of the anti-wrinkle face cream, a self-limitation would mean that the cream cannot erase wrinkles at all. A comparative limitation would mean the cream can prevent wrinkles, but not as well as a different cream. So a self-limitation is an absolute matter, while a comparative limitation is a relative matter. This distinction is one that you will need to make over and over again as you weigh and balance one option against another for your menopause management. Everything, absolutely everything, has limitations. And the degree of limitation can vary from woman to woman or from situation to situation. This is why it's so important to always tailor all the information specifically to you. So, we will assess both types of limitations for estrogen replacement, and we'll do so by addressing each category of limitations separately as they pertain to the three big diseases of estrogen deficiency. So starting with self-limitations, you've already learned that estrogen is limited in terms of time, dosage, and duration. Now, what do I mean by that? Well, it all goes back to the things I taught you about the estrogen window and all its requirements. The time limitation refers to the fact that you have to start estrogen replacement early before you develop a disease in order for it to prevent the disease. The dosage limitation refers to the fact that you have to take a certain minimally necessary dosage in order for estrogen to prevent the disease. The duration limitation refers to the fact that estrogen only prevents the disease while you are taking it. Once you stop taking estrogen, you start developing the disease. You've already seen that these three limitations hold true for all three diseases. But let's reiterate by means of example for each disease, just to be sure you really understand the nature of these limitations. So let's start with heart attack. You know that estrogen is what keeps your lipid levels in the normal range. It also prevents buildup of plaque in your heart arteries and keeps them soft and supple. When you lose your estrogen at postmenopause, all of these things begin changing in ways that increase your risk of heart attack. Taken together, these three things, abnormal lipids, plaque buildup, and hardening of your arteries, constitute the aging process for your heart. So the question is, just how much can estrogen replacement do to prevent the changes that lead to a heart attack and prevent the aging process of your heart? And in contrast, what is estrogen incapable of doing? What are its limitations? Well, let's pose some individual inquiries here. First is time limit. What if you wait a few years to start estrogen replacement, and in those years, your lipid, plaque buildup, and arteries start going awry? When you start taking estrogen replacement, will it reverse those changes? No, absolutely not. In fact, this is the very situation that has resulted in some studies claiming that estrogen replacement causes heart attacks. Of course, there's a whole lot of middle ground between preventing a heart attack and causing a heart attack. It's possible that you could start estrogen replacement late and merely prevent further plaque buildup and hardening of your arteries without causing a heart attack. So don't assume that things go directly from one extreme to another. Everything does not act in an all or none manner. But while estrogen replacement can prevent the aging of your heart, if you start taking it after your heart has already undergone the changes of aging, it can be more risky than beneficial. It's always going to boil down to the benefit-risk ratio. In other words, you have to assess which weighs more for you, the benefits of estrogen replacement or the risks of estrogen replacement. Now for dosage limit. What if you take a dosage of estrogen replacement that is lower than the minimal necessary dosage designated for your estrogen product? Will it still provide the benefit of preventing a heart attack? You should already know the answer to this one. It's a definite no! This is one area in which you definitely should not apply the quote, "the only limitations are the ones in your own mind." Now this limitation is very important, especially with the goofy mantra, take the lowest dosage for the shortest time, guiding the way for many professionals practicing menopause medicine these days. The lowest dosage of most estrogen replacement products is not adequate for purposes of preventing a heart attack or osteoporosis or Alzheimer's. And that leads into the next limitation. Duration, limited duration. What if you take estrogen replacement for 5 years and then stop it? Will those 5 years of estrogen replacement continue to prevent a heart attack even after you stop taking it? No, no, no. Estrogen replacement will only prevent the heart attack and provide a heart benefit while you take it. When you stop, the aging process of your heart will begin. This is why the second part of the mantra, take the lowest dosage for the shortest time, is so ridiculous. So the self-limitations of estrogen replacement with regard to preventing a heart attack are, you have to start taking it early before you have aging of your arteries. You have to take at least the minimal necessary dosage, and you have to continue taking it in order to continue getting the benefits. These are all self-limitations of estrogen replacement itself. Now let's move on to osteoporosis. You know that estrogen loss causes bone loss, period. Estrogen is what keeps your bone dense before postmenopause, and estrogen is all about bone quantity. It does not pertain to bone quality. So let's see how estrogen replacement fares with regard to our list of limits. First is time limitation. You know that you have rapid bone loss in the first 5 years of postmenopause. So what if you wait until you are 5 years postmenopausal to start estrogen replacement? What effect will it have on your bones? Well, if you go back to the basic principle that estrogen loss causes bone loss, then you realize that estrogen replacement prevents bone loss. So you would stop losing bone when you start taking estrogen. It would be like putting the brake on your bone loss. Estrogen replacement would halt your bone density and keep it where it is. But what about replacing the bone you've lost? Does estrogen replacement result in bone replacement and build bone? Nah. That's taking things too far. Estrogen's job is to maintain bone, not to build bone. So you would not lose more bone, but you still would not replace the bone you've already lost either. What this means is that a self-limitation of estrogen replacement is that it can only stop bone loss and keep your bone as dense as it currently is. It cannot increase your bone density. And what about the dosage limit? If you take a dosage of estrogen that is lower than the minimal necessary dosage to prevent bone loss, will you still prevent bone loss? Please do not apply magical thinking here. Of course not. You will shortchange yourself. So estrogen does have a dosage limitation for osteoporosis, just like it does for heart attack. And this is another instance in which the mantra about taking the lowest dosage for the shortest time makes no sense. And what about the duration limit? If you take estrogen replacement for just 5 years and then stop it, will your bones stay dense, or will you start losing bone? Surely you know that you will start losing bone. Why? Because estrogen estrogen loss causes bone loss. So estrogen will only benefit your bones while you are taking it. So once again, this is just yet another strike against the moronic mantra. So the self-limitations of estrogen replacement with regard to preventing osteoporosis are that you have to start taking it early before you lose bone. It will only prevent bone loss, prevent it, and it will not replace already lost bone. You have to take at least the minimal necessary dosage, and you have to continue taking it in order to continue getting the benefit of keeping your bones dense. These are all limitations of estrogen replacement itself. For Alzheimer's, you've learned that your brain is covered with estrogen receptors. So estrogen is a form of fuel for your brain. It has a huge impact on how well your brain functions. And when you lose your estrogen at postmenopause, those estrogen receptor sites go empty. And that results in poor brain function. Over time, that poor brain function due to estrogen deficiency results in brain shrinkage, which is Alzheimer's. So the question is, what are the self-limitations of estrogen replacement with regard to preventing Alzheimer's disease? Starting with the time limit. What if you don't bridge the gap between losing your own estrogen and starting estrogen replacement? If you wait 5 years to get started and your brain starts shrinking, can you make up for the 5 years during which you didn't take estrogen? No, my dears, you cannot. So this is a limitation of estrogen replacement. It is the starting time limitation. So any brain shrinkage that occurs before you start estrogen replacement will persist. Now, if estrogen replacement prevents brain shrinkage, does that mean it induces your brain to grow? Once again, there's a big difference between preventing shrinkage and inducing growth. Estrogen replacement does not make your brain grow. You do not gain new brain tissue. You merely preserve what you already have. And dosage? What about that limitation? If you take a teeny tiny dosage of estrogen that is well under the minimal necessary dosage for preventing Alzheimer's, will you prevent Alzheimer's? Magical thinking again? You absolutely will not. So don't delude yourself into thinking that a little bit will do a little bit of good for your brain. That little bit will leave you with a very little brain. Do you see how this goes against the mantra too? The duration limitation is next. If you take estrogen replacement for 5 years and then stop it, will the benefit to your brain continue? Please tell me that you know darn well that it will not. Just as is the case with heart attack and osteoporosis, estrogen only benefits your brain while you are taking it. If you stop, the benefits stop, and the aging process of your brain begins. So the self-limitations of estrogen replacement with regard to preventing Alzheimer's are, you have to start taking it early before your brain starts shrinking. It will only prevent brain shrinkage. It will not make your brain grow. You have to take at least the minimal necessary dosage, and you have to continue taking it in order to continue getting the benefit of preventing brain shrinkage. These are all limitations of estrogen replacement itself. If we chart these self-limitations of estrogen for these 3 diseases, it's a very redundant chart. You see that for all 3 diseases, estrogen replacement has self-limitations with regard to timing, dosage, and duration. Back in the unit on osteoporosis, I used the concept of lanes to explain the differences between prevention, intervention, and fixin'. Prevention is when something can prevent the disease in the first place. It's what you do before you have the disease. Intervention is when you have the beginnings of the disease already and you need to halt its progress. Fixin' is when you have severe disease and need to reverse it. So, if I were to plot these self-limitations of estrogen according to these 3 lanes, it would look like this. Now let's move on to the comparative limitations of estrogen replacement. This entails comparing what estrogen can do to what all the other management options can do. So we will compare what you can accomplish with estrogen replacement against what you can accomplish with diet and lifestyle, exercise, vitamins, minerals, and supplements, herbs, and non-hormonal medications. If estrogen can do the same or more than the other option, then it does not constitute a comparative limitation of estrogen replacement. If estrogen cannot do the same or more than the other option, then it does constitute a comparative limitation of estrogen replacement. And once again, we'll do this one disease at a time, starting with heart attack. I've given you individual videos on all of these other management options for heart attack, and of course I'm not going to rehash everything here. I'll merely summarize the bottom line for purposes of determining whether or not estrogen replacement is limited in comparison to each of these other diseases. The big key to limitations is to acknowledge what a management option cannot do. If two management options are equally capable of accomplishing a goal, then neither has a limitation compared to the other. If one can accomplish a goal but the other one is just not capable of doing so, then the one that cannot accomplish that goal has a limitation. So starting with dietary and lifestyle options for preventing a heart attack. The question is whether you can prevent a heart attack with your diet and lifestyle as well as you can with estrogen. Well, you know that you can prevent a heart attack with your diet and lifestyle. Just think of all the things that are promoted as heart healthy these days. Estrogen isn't necessarily better than diet and lifestyle. It might be easier, but it isn't better. So estrogen is equal to diet and lifestyle in its ability to prevent a heart attack. So this is not a comparative limitation of estrogen replacement. Now just for kicks, what if you're a junk food, fast food, processed food, sugar-laden food junkie, and your diet is very non-heart healthy, and in addition, you smoke? In essence, what if your diet and lifestyle are heart attack worthy? Can estrogen overcome the damage that you do to your heart arteries and still prevent a heart attack? No, absolutely not. Estrogen will not overcome a heart attack producing diet. The diet itself will still derange your lipids, increase your plaque buildup, and harden your arteries. Estrogen replacement might slow the rate of these changes, but it cannot overcome them. Some would use the word compensation at this point. Compensation means that you end up with the same benefit from one option that you get from another option. In other words, it means that it makes up for something else. So estrogen replacement will not compensate for bad dietary and lifestyle habits. What about exercise? Can you prevent a heart attack with exercise as well as you can prevent one with estrogen replacement? You sure can. So exercise is also equal to estrogen in its ability to prevent a heart attack. This means that estrogen does not have a comparative limitation in terms of its ability to compete with exercise for preventing a heart attack. And again, what if you're a complete couch potato and never exercise? Can taking estrogen replacement compensate for your sedentary lifestyle and do what exercise can do to prevent a heart attack? No way, no way. You cannot replace inactivity with estrogen replacement. In other words, estrogen replacement will not benefit you in the same way that exercise will. What about estrogen's limitations compared to the capabilities of vitamins, minerals, and supplements? In other words, do vitamins, minerals, and supplements offer a benefit that is more than what estrogen can do for preventing a heart attack? Absolutely not. In fact, it's the other way around. Estrogen replacement can prevent a heart attack much better than any vitamin, mineral, or supplement. This is a very important distinction. Sometimes women try to use these products instead of using estrogen replacement. They try to accomplish the same benefits with vitamins, minerals, and supplements that estrogen provides. And this is a big mistake. No vitamin, mineral, or supplement can prevent a heart attack nearly as well as estrogen can, if at all. Failing to realize this has dire consequences. This does not mean that vitamins, minerals, and supplements have no heart benefits. It just means that they cannot compensate for those of estrogen replacement. So estrogen has no comparative limitation when you compare it to vitamins, minerals, and supplements. And with herbs, it's the very same situation. You would be in big trouble if you tried to do with herbs what you can do with estrogen in terms of preventing a heart attack. But let's make a distinction here. timing issue of estrogen and heart attack, and you compare estrogen replacement versus vitamins, minerals, and supplements after you already have aging of your arteries, the story changes. In such cases where estrogen replacement can cause a heart attack, vitamins, minerals, supplements, and herbs can be better than estrogen. In those cases, estrogen replacement would have a comparative limitation. And it would boil down to the fact that starting estrogen too late could cause a heart attack, whereas none of these other options would. And the last category of options for preventing a heart attack is the non-hormonal medication options. These include things like statins, aspirin, and blood pressure medications. All of these are intended for women who already have either a very high risk of heart attack or significant heart disease. They are intended for purposes of treatment, not prevention. And the question is, can estrogen replacement treat buildup of plaque in your arteries as well as they can? What if your lipids are so high that you need a statin drug? Can you take estrogen replacement instead of a statin drug and accomplish the same thing? Nope. Sorry, Charlie. Estrogen and statins do not work in the same way or accomplish the same goals. You see, this is so critical. It is the very reason that some women get confused thinking that that there are conflicting studies on estrogen's effect on your heart. It all just boils down to timing again. If you don't have plaque buildup in your arteries, starting estrogen replacement can prevent a heart attack. Your arteries are still young and they can still handle it. But if you already have plaque buildup in your arteries, starting estrogen replacement can make it worse because your arteries are already too old to handle it any longer. But the statins are made precisely for arteries that already have plaque. So when it comes to the non-hormonal medication options for preventing a heart attack, estrogen has a comparative limitation. Estrogen cannot prevent a heart attack, but these drugs can. So when it comes to estrogen replacement, it has a comparative limitation compared to non-hormonal medications, but not to vitamins, minerals, supplements, and herbs. Now, let's address the comparative limitation of estrogen for osteoporosis. Can you use estrogen replacement instead of diet and lifestyle and get the very same benefit for your bones? Now, this is a bit tricky, and that's because it's a matter of degree. If you recall video 216 on dietary options for preventing osteoporosis, you learned that there are foods that decrease your risk of osteoporosis and foods that increase your risk of osteoporosis. And you learned in video 203 that there are a bunch of lifestyle risk factors for osteoporosis. Well, there is no food that can actually prevent osteoporosis. Estrogen can, but food cannot. So estrogen can do everything food can do and more when it comes to preventing osteoporosis. And then lifestyle encompasses smoking, alcohol, and caffeine. These are things that increase your risk. This means that estrogen does not have a diet and lifestyle limitation in the realm of osteoporosis. So estrogen replacement does not have any comparative limitations against diet and lifestyle for preventing osteoporosis. In video 211, you learned that exercise is the most important lifestyle measure for preventing osteoporosis. So does estrogen have a exercise limitation? In other words, can estrogen do the same thing that exercise can do for your bones? Once again, this one is a bit tricky. Estrogen functions only to increase the quantity of your bone, to keep it high, so it prevents osteoporosis. Exercise prevents osteoporosis when your bone is normal in density. But once you've lost bone, exercise does not replace that bone loss any more than estrogen does. But exercise does have one benefit that estrogen does not have. Exercise can improve your balance, flexibility, and core to prevent falling. Do you see how critical it is to know these capabilities and limitations of each option? So exercise has one particular benefit over estrogen, albeit an indirect one. Overall, though, estrogen replacement does not have enough of a comparative limitation compared to exercise to really go either way. They're a toss-up. Now, what about vitamins, minerals, and supplements? Can they do the same things that estrogen can do for your bones? Please tell me that you know they cannot. This is the quantity versus quality distinction. Estrogen is all about bone quantity. Vitamins, minerals, and supplements are all about bone quantity. Well, which one is osteoporosis? Osteoporosis is about bone quantity. So estrogen replacement does not have a comparative limitation against vitamins, minerals, or supplements for preventing osteoporosis. Quite the contrary. It has a huge comparative benefit. And once again, the same goes for herbs. We're seeing that by and large, vitamins, minerals, supplements, and herbs hold the same place on the hierarchy of options. Most of the time, they are the least capable categories of options. Now, what about those bone-building medications? Here, the question is, if you have lost bone already, can estrogen do the same thing for your bones as the bone-building medications that I taught you about in videos 222 and 224? Once again, be mindful of estrogen's limitations. All it can do is maintain the bone you have. But the SERMs and hormonal bone medications build bone. They replace lost bone. So they perform a function that estrogen cannot perform. This constitutes yet another limitation of estrogen replacement. So estrogen replacement has a comparative limitation when compared to bone-building medications. And finally, we get to Alzheimer's. How does estrogen replacement compare to other categories of options for preventing Alzheimer's? You learned in multiple Alzheimer's videos that diet and lifestyle factors are huge contributors to your risk profile for Alzheimer's. The question is, can estrogen do as much for your brain as all those diet and lifestyle measures? Now, this one is a close call. You get a lot of brain benefit very easily by taking estrogen, whereas you have to do a whole heap of things to get the same benefit from diet and lifestyle. But it is possible. The problem is that people tell themselves they'll do what it takes to prevent Alzheimer's, but then they usually don't do it. Still, we're not going to designate this as a limitation of estrogen replacement. Estrogen replacement does not have a comparative limitation when compared to what diet and lifestyle factors can do to prevent Alzheimer's. And then with exercise, the same is true. The benefits of exercise on your brain are enormous. It would not be fair to say that estrogen is incapable of accomplishing what estrogen can accomplish. So estrogen replacement does not have a comparative limitation when compared to exercise for preventing Alzheimer's. Do you see how some of these principles hold true regardless of the context? And then for vitamin, mineral, and supplement category of options, you learn that nothing in this category is truly capable of preventing Alzheimer's at all. But estrogen is. So that means estrogen replacement does not have a comparative limitation when compared to the category of vitamins, minerals, and supplements. Ditto for herbs. There is no herb that can prevent Alzheimer's to the extent that estrogen can. So estrogen replacement does not have a comparative limitation when compared to herbs. And finally, we have the other options compared to estrogen, like non-hormonal medications and such. But you learn that there are no other medication options for Alzheimer's prevention. Remember the Alice in Wonderland video when I likened all the medications for Alzheimer's to a fantasy, like the one Alice had in Wonderland? See, this means that estrogen is your only hope. It is not a limitation. So, estrogen replacement does not have a comparative limitation when compared to the category of non-hormonal medications for Alzheimer's. Time to put all this on a chart. What you see there is that there are very few comparative limitations of estrogen replacement when you compare it to all the other categories of options for preventing heart attack, osteoporosis, and Alzheimer's. This means that estrogen replacement can accomplish most of what you need for preventing these three diseases with very few limitations. But what those limitations are is very key. Now, if I combine these two charts, here's what we get. I won't go through it because all I have done is attach the second chart to the first chart. There's really nothing new to tell you. But you can find this chart in the description box just below the screen or on my website, which is menopausetailor.me, if you want to print it. Do you see why I teach you each thing in sequence? You know, if you didn't watch all my videos in order, you would have a whole lot of misconceptions still. You would think that the videos you have seen constituted the whole story, but they don't. I have consultations all the time with women who have watched a few videos just randomly without getting the entire education. And what they do is they mix all sorts of misinformation in with what I've taught them in those particular videos. Their knowledge base is a complete mess. They have sabotaged themselves because now what they have to do is erase the misinformation. And the problem is that most of the time they don't know which information is the misinformation. Please be careful. We live in a time when people really think they can learn without doing so in an orderly manner. And it's a huge fallacy. There are definite limits to what you can learn accurately if you go about it in a chaotic manner. And so what you've learned here today is that estrogen replacement is one of your best options for preventing the 3 diseases due to estrogen deficiency. But its limitations are all about when you start it, what dosage you take, and how long you stay on it. This does not mean it isn't worth taking estrogen at all if you can't start it early in your postmenopause or can't take the minimal necessary dosage or can't stay on it long term. It just means that you have to adjust your expectations for what it can accomplish. I'm a realist. I always teach in a way that helps you deal with reality. And that's what knowing about the limitations of any option is all about. So that does it for today. One of the things we've talked about very little thus far is progesterone. So next week I'm going to address the role of progesterone with regard to the 3 big diseases. And when we get to the unit on breast cancer, I'll address the role of progesterone for it too, because that's where it's ultra important in a very detrimental way. Subscribing is something you can do right here, right now. Following me is something you can do on FaceTime, Twitter, and Instagram anytime. And scheduling a consultation is something you can do and should do anytime you want my help. And for that, go to menopausetailor.me. Until next week, bye-bye.